Well, good afternoon, and I want to thank John Corus and the folks here at Tampa General. We're going to hear from some of the doctors about some of this stuff, but one of the things specifically, we had a roundtable with a number of folks running major hospital systems across the state yesterday. John was one representing Tampa, also had folks from Orlando, Miami, Fort Lauderdale. And we're discussing things, what they're seeing in terms of efficacy of vaccine, what they're seeing in terms of patient census. But we started to discuss the monoclonal antibody treatments. And John has been involved in that, and they've done it here at Tampa General for a while. A lot of folks started contact say, well, we didn't even know about this. And so what we wanted to do is let some of them talk about how that is impacting positively patients. If you remember last November, when the Pfizer data came out for the vaccine, that obviously made really big news. But around that same time, you were getting EUAs, or it was in the pipeline to where the data was coming out for some of the monoclonal antibodies, including Regeneron, which is what Tampa General had been doing in their trials. I went up to meet with Warp Speed when the Pfizer data came out last, I guess, November. And we obviously were planning on the vaccine distribution, all that. But I also was talking about the monoclonals. And they said, well, you know, the hospitals aren't going to want to do it because you got this infusion center, so you guys got to figure out, maybe you have to set something up. So I called John and others. I called John. I said, so do you want us to do something? He said, no. We're all over this. We're going to do it. And so they've really leaned into it. Obviously, when you have the Pfizer, Moderna, and then eventually J&J, people who were not infected wanted to get that. So that was obviously that was kind of the number one thing, got all the attention. The monoclonals got very little attention and have still really gotten very little attention, but these are now authorized for the treatment of people who have contracted COVID. You usually got to do it early, so it's really for people that have mild to moderate symptoms. And this has been shown to basically, if people aren't creating an immune response, if they're not developing antibodies in response to the infection, this is an antibody cocktail that gets administered via IV and provides an ability to fight back. And the results in the trials were a 70% reduction in hospitalization or death. And I think the data, and they'll talk about the data here about how that's gone, but I can tell you, you got to go with data, you can't go with anecdote. At the same time, 100% of the people that I've talked to who have done this will say they felt really bad when they got infected, they got it, and it cleared within 24, 48 hours a lot of time. Obviously, President Trump had it famously before it got the EUA last October. And so they're going to discuss kind of how that can be administered. But I think the message is just simply that if this is going to work, you really got to do it early. If you test positive and kind of just wait and hope that it doesn't get worse and then it starts to get very severe, by that time, doing a monoclonal antibody treatment is probably not going to be something that's going to turn the tide. However, if you're somebody, particularly somebody who's high risk, if you get infected, you probably would develop a symptom and then get tested, and then you see that, and then you go do it early in the infection. This has a really, really good track record. So we just want people to understand that, because I think that, you know, when you have high prevalence in a community, there are going to be people who are going to be testing positive, and they may say, well, you know, I'm fine, even if they may be more higher risk. I'm fine, I don't really feel. And then if it progresses, then at that point, you've kind of missed. So we want people to be talking with their physicians. I think if the physician writes the prescription for it, I think they follow through, and they have their infusion center and everything. And it is, if you've been vaccinated and get infected, they will still do it. And this has been proven to be effective against all the various variants that you hear about. So this Delta variant, this monoclonal antibody with Regeneron at least, has been proven to be effective. The U.S. government purchased the entire stock. So this is just here of Regeneron, and so people can get it, and we want them to get it. So I'm going to let John Corus come up, say a few things, and then we'll hear from the physicians.
Thank you very much. Well, couple things. What I'd like to do with you today is just give you a little bit of situational awareness of what's happening at Tampa General. I'd like to talk a little bit about Regeneron. Before I do that, though, I want to thank the governor in the state of Florida. From the beginning of the pandemic, this state has been with us from the beginning, and not just with Tampa General, but with the entire healthcare community across the entire state. Regeneron is a great example. Early on, when we didn't know what we didn't know, because this pandemic is new, it's novel, the state was with us every step. And when the governor called and said, do you need help with Regeneron? And I was fortunate enough to say, no, we've got this because of our partnership with USF and USF Health, because under Dr. Kami Kim's leadership and our dean, Dr. Charlie Lockwood, we were doing research with Regeneron and Eli Lilly, way ahead of so many. I said, we're on top of it. But the governor made it very clear that if we needed anything, we just needed to pick up the phone and ask. And that was for not just Regeneron, but for, quite frankly, anything we needed to deal with and combat COVID-19. So I want to thank you for that, not just on behalf of Tampa General and USF, but really the entire healthcare industry. I also want to thank and recognize our doctors, our nurses, our respiratory therapists, our environmental service workers, our transporters, our patient transporters, and so many others that are sacrificing every day through this surge. They are truly sacrificing for their communities and for this state, and they are doing an incredible job, and they need to hear this. They need to be recognized, they need to be celebrated, because they are saving lives and they are making a difference, and they are sacrificing for all of us. Now, as it relates to the response and the impact that's happening at Tampa General, we currently, just to kind of give you situational awareness, we have 136 COVID patients currently in-house. This is as of this morning, 7:30 this morning. And this is very fluid, everyone. You know, volumes are fluid, severity of illness is fluid. The whole pandemic, as you all know, is very fluid. But as of this morning, we have 136 patients. 54 are in our ICUs. 13 of the 54 are on ventilators. We admitted 22 patients in the last 24 hours, but we also discharged 15 patients healthy into home in the last 24 hours, 15 patients discharged. The average length of stay for a patient in a med-surg COVID unit, not in the ICU, is 5.5 days. The average length of stay for a patient in our ICUs is a little over 14 days. 85% of our patients are unvaccinated right now. The 15% that are vaccinated, and this is really tricky, and I know that this entire pandemic is complicated, it can get confusing, and quite frankly, it can be anxiety-provoking to those that are not close to it. When they look at this and they think, wow, there's a lot of vaccinated patients coming into the hospital and being admitted, people have to realize that the vast majority of the 15% of the vaccinated patients that we're caring for, and we're a microcosm of what's happening across the state, and I would submit to you probably across the country, are patients that are already immunosuppressed. And those patients are transplant patients, they're cancer patients, they're individuals that have been vaccinated, didn't have the response to the vaccine that maybe you and I might have had. Then they get COVID, no fault of their own, and then they get sick, and they end up in an institution like Tampa General Hospital, because we're an institution that tends to take care of the sickest and most complex patients in the region. So most of these patients are those types of individuals. And then the balance are older patients, people that are in their 70s and 80s, and even in their 90s that have comorbid conditions. And I think it's very important for the public to understand that as they think about and learn more about the COVID-19. Now, what's also very important is Tampa General Hospital is open for business. Please, if you're listening to this, do not delay care if you're out in the community. if you have chest pain, if you're suffering from stroke symptoms, come to the emergency room. Ideally, the closest ER to you. Do not delay needed care. Hospitals across this state are open and they're taking care of people that need health care. That is very, very important. At Tampa General, not only are our ERs open, but our surgery schedules are open. We are treating patients, we are operating on patients. Now, don't get me wrong, our staffing is tight, our ERs are full, and if you're coming to the ER and you have a sprained ankle and you want to be seen, yes, you might wait longer than you typically would wait, because we're caring for those with chest pains and stroke symptoms and trauma-related injuries in COVID patients, so you might wait a bit longer. But the institution is open and we're operating, and we are watching this moment by moment. So if we believe that we're in an unsafe environment and we need to slow down surgeries, we will do that. We will absolutely do that. Our operating and clinical teams watch this hour by hour, and you can be rest assured that we are absolutely on top of this. What's going to happen now is I'm going to invite our dean and then Dr. Kami Kim up to talk about the monoclonal antibodies. One of the things we're very proud of is the Global Emerging Diseases Institute that we established a year ago in collaboration with USF Health to deal with infectious disease and to really tackle COVID-19. And one of the outcomes of that is the monoclonal antibody work that we're doing. And the governor is absolutely spot on. This is a therapy that is effective. This is a therapy that is less known. This is a therapy that needs to be taken advantage of. And this is a therapy that Tampa General Hospital and USF and our private practice physicians are using very successfully on positive COVID-19 patients. And with that, I'd like to introduce the Dean of the Masani College of Medicine at USF Health, Dr. Charlie Lockwood. Thank you very much.
Well, let me reiterate, first of all, thank you for your leadership. It's been terrific to kind of know you have our back. And secondly, thank you for your leadership. It really has been a textbook of how to lead, and we are all very grateful for that. So we're very proud of our partnership with Tampa General. We have literally taken care of the sickest patients in the region with some of the best outcomes in the country, particularly for the really critically ill patients that are on what's called ECMO. We've launched over 60 clinical trials, and Dr. Kim deserves, I think, a medal for that. I think it was the fastest rollout of clinical trials, certainly in USF's history. We developed a 3D printed flock nasopharyngeal swab because we knew there was a shortage of these swabs for collecting kits. We released that formula worldwide. Over 70 million of these have been made, which is an incredible achievement. We covered our county testing sites. We performed over 50,000 tests. I was out there for many weeks sweating and didn't lose any weight, but we were happy to do that. With the help of actually the governor, the White House task force came here. They worked with us to develop pool testing, so we're able to use our research labs to screen our students. And because of that and other mitigation steps, USF's campus has had one of the lowest infection rates among our students, faculty, and staff of any university in the country. We developed a COVID continuity clinic to help county patients that didn't have docs. We would follow them virtually with telehealth. We began to give them monoclonal antibodies to keep them out of the hospital, and you'll hear more about that from Dr. Kim. Chronic COVID clinics, because long-term COVID care is going to be a big part of what we need to do. And this facility, which was the brainchild of Dr. Corus, John Corus, soon to be doctor. He's getting his business PhD. And in fact, this has been a godsend because it's expanded our capability of taking care of these patients, provided many additional ventilators if needed, hopefully it won't be, and been a platform for doing these clinical trials. So we can take care of you if you're sick, but we'd rather you not come here. And the way to avoid coming here is to get vaccinated. So vaccination, and I'm going to kind of pull a bunch of data for simplicity's sake, protects you from hospitalization, from death, and from long-term COVID symptoms by about 90%. If you have been vaccinated, you have about a 70% protection against mild to moderate infections. Now, vaccinated people can still get infected. We've had 3 people on my team in the last 2 weeks that have gotten infected, and they were all vaccinated. But unless you're immunocompromised, as John pointed out, you're going to do pretty well. It's very unlikely that you will end up in the hospital. And vaccinated patients that do develop these so-called breakthrough infections, should stay home. They need to quarantine. They are potentially contagious. They seem to be more contagious than we thought in the past, but probably have a shorter duration of illness and of being infectious. Bottom line is, if you've been vaccinated, this COVID surge, this 4th surge, is the equivalent of an influenza season. So that's why you need to be vaccinated. Now, on the other hand, for those immunosuppressed patients, here at Tampa General, the transplant patients, the cancer patients, patients with rheumatoid arthritis or multiple sclerosis, their own immunosuppressants, they need to be wary. They don't mount an antibody response. They need to wear masks. They need to socially distance. They need to, if their doctor suggests, stay home. And that's really important as well. So, again, I will point out this fantastic facility designed not just for COVID, but for other infectious diseases. The Global Emerging Disease Institute, JEDI is what we call it for you Star Trek fans. And we take care of patients really well here, and we allow them access to 60 different clinical trials. And the work is really 24/7. Dr. Kami Kim is the chief of our infectious disease group. She has been the busiest physician for the past 15 months that I've ever seen. I don't think she's taken any breaks. And she's going to get into more detail about the monoclonal antibodies.
Thank you. And as John Corr said, Tampa General and USF have been local leaders in the studies of monoclonal antibodies, and we were the first system in Florida to offer monoclonal antibodies to COVID patients. And as you can tell, I've been very fortunate in having the support of the leaders both at my hospital and my university. So I want to thank Dean Lockwood and Mr. Couros for their unbelievable support. From the beginning, they sort of said, we want to treat this, we want to be on top of it, and we want to make sure we give the best treatment to all of our patients. So that's happened. And so far, we've treated over 1,600 patients with monoclonal antibodies to treat COVID. And these treatments, as Governor DeSantis and Dean Lockwood and Mr. Couros said, prevent the virus from infecting our cells. And so you probably heard them called neutralizing antibodies, and that's because they neutralize the virus. So that's a pretty powerful treatment against the virus that is very, very effective in our own studies and in studies across the country. So we ourselves, because we wanted to verify all these things, looked at the first 200 infected patients with mild to moderate symptoms, and these were initially high-risk patients for severe COVID, and that showed that 70% of hospitalizations were prevented by receiving these antibodies. A bunch of other studies across the country have shown similar positive effects. So this treatment is effective in resolving symptoms, decreasing viral shedding, and then obviously if you have less virus and your symptoms go away sooner, you're much less likely to end up in an emergency room, in the hospital, or in an ICU. And then more recent data has come out that not only are these antibodies very effective for treatment of COVID, but they seem to be very important tool for potentially preventing COVID in people who have been exposed. So this is also exciting new data. And so what are these monoclonal antibodies? So this is an infusion of antibodies that fight the infection. They're targeted toward the virus, and while it's in your body, and preventing it from basically attacking the cells in your body. And so it's so people are a little bit confused. Is this new? Should I be afraid of the treatment? In this particular case, the monoclonal antibodies are a type of drug that are well established in treatment of autoimmune disease, cancer. They're life-saving treatments that have been used for decades. And so this is just a new drug used to combat COVID for something that's well established for complicated patients. So as the previous speaker said, this is a treatment that's really important. It attacks the virus, so you want to get it into you early on, within 7 days of when symptoms appear. And it's particularly useful for people who need a little help with their immune system. So ongoing medical conditions, especially those that suppress their immune system. So initially, because obviously we were cautious with a new drug, we treated high-risk individuals, people who were older, who had medical problems, diabetes, heart disease, people who were obese, lung disease, immunosuppression. But now what we found with over 6 months of experience is these treatments are very, very effective in pretty much everybody. And so now the FDA has allowed a lot more discretion. Providers, so physicians, nurse practitioners, and things like that, who talk to their patients and feel that someone's high risk enough that they could benefit from monoclonal antibodies, we have the discretion for administering it to pretty much anyone that might be high risk. And that includes someone who's vaccinated but still is having symptoms that might be severe or otherwise might benefit from the monoclonals. So these are really, really important treatments. They help people recover more quickly. People have less severe disease. They have less virus, so they're less likely to give it to somebody else. And so if you can make people have less severe disease, obviously they're not going to end up in our hospital and in our ICU and potentially dying. So obviously, we have a lot more to offer people than we did even a year ago. We have highly effective vaccines, and that's the first line of defense, so I would encourage everybody to get vaccinated. Obviously, at this point, we've given hundreds of millions of people vaccines, so I think many of the safety concerns seem not to have turned out to be true. However, if you're unlucky enough to get COVID, the monoclonal antibodies clearly work, and they'll help an individual recover more quickly from COVID and also likely prevent them from being hospitalized. So I think this is a really important treatment that we didn't have a year ago. So thank you very much.
Well, thanks, Dr. Kim. Thanks, Dr. Lockwood. Thanks, John. And so these monoclonal antibodies have been used now. So you guys were doing a trial even last fall, but they've been used in earnest pretty much all of 2021. The results have been very, very positive. The key is, though, is you got to get it in time. You got to get it early enough in the infection for it to be able to neutralize the virus. And I think if the fact that people know about it is kind of half the battle, because if you don't know about it and you get test positive, you may think, hey, I'm going to be okay. I don't feel that bad, even if you're high risk. And this is, I think, just saying, talk to your physician, understand this is there, ask questions about it. I think they, here at Tampa General, as I mentioned, they were on it from the very beginning, and they really embraced it, and I think that they've had a really good track record. So, and that's even if you're vaccinated, if you test positive, there are people testing positive. I think sometimes there was a sense that, and look, I had hoped that the vaccines would just completely shut off any chance of infection and that you'd have a big herd immunity, and that obviously isn't happening. I think people are testing positive, but you do have this reduction for the people who are vaccinated, as Dr. Lockwood said, a real reduction in mortality, and make it basically a flu-level risk. And that's something, particularly for elderly people, that's much better than what it was last summer when we didn't have any of this. And so, much better situation to be able to have access to the monoclonals, and we just want people to know that they are being used all throughout Florida. And if you're somebody who, in a high prevalent time, more likely to test positive today than people were 2 months ago, just know that that's there, but just know that you got to do it early. So thanks, everybody, for doing this. Take a couple questions. Yes, ma'am.
Mostly young people, the unvaccinated people. But, Governor, why do you think we're seeing this peak, and what is the state doing to it?
So I think we anticipated, and I said publicly, this is our COVID season. We thought we would see an increase. I don't know that we thought we would necessarily see this many positive tests and some of the hospital admissions, just because if you look, we've got 91% of seniors who are the most likely to be hospitalized have gotten at least one shot. It's pretty much of age 50 and above, it's 80% roughly who are vaccinated. And of course, people have recovered from COVID in those age groups too, so that's even more in terms of the immunity. But I think that this Delta variant is more contagious. I think it's aerosolized. I think it's highly transmissible. We saw that in the United Kingdom, saw a really quick ascent. And it tops off and then comes down. So I think that it's following similar pattern. It's just going very quickly. And but I do think, as John Corrs said, they're handling it. It's interesting. Tampa, Orlando had more COVID patients this summer than they did last summer. Miami-Dade and some of them, they have less. Jackson Hospital system is about 50% of where they were. So they've increased this summer, but they've not gotten close. I think part of it is they just got hit a lot harder, and they have more natural immunity based on last summer. But we think sending the message about the monoclonals, we obviously worked very hard to offer the vaccines to seniors first, but then to everyone who wanted it. But certainly, the name of the game is, if you're infected, we just want you to be okay. And if you do this, the chance of you having one of those 14-day hospital stays in the ICU goes down dramatically. And of course, the chance of surviving it increases significantly. And so that's really the name of the game. And I think it has made a big difference. But I think if this can now tell people who may not have known about this, maybe they make that phone call 2 days earlier because they know that this is something you got to take earlier, and I think that could be very positive.
Governor, 6 attorneys in Tampa Bay are planning on filing a lawsuit in the coming days challenging your executive order banning mask requirements in schools. I just spoke with them a little bit ago. They said that it's unconstitutional because it should be left up to school boards. What is your response?
So the legislature passed a Parents' Bill of Rights that I signed into law about a month and a half ago and laid down the law in the state of Florida is that parents have the fundamental right to raise their children, their health and well-being, and that has to be respected by the state at all levels of government. And so it's our belief that this should be a parent's choice. I think it flows directly from that bill, and I think we'll end up winning to do. At the end of the day, as a parent, I would like that choice. Particularly for young kids, many of these kids, by the way, have recovered from COVID, and so there's really no scientific justification to put it on at that point if there is to begin with. But I think a lot of the parents would just want to have that ability. I know they've had all this time to study. What are the harmful effects of putting a kindergartner in a mask for 7 hours? Have they talked about the emotional, the academic, the physiological? Why isn't CDC studying that? They've had a lot of time to do it, but yet you don't do it. And to act like somehow that this is just something that we shouldn't worry about, I don't think is acceptable. So I think the fairest thing to do is just say let parents make the decisions. I can tell you from having a whole school year under our belt, because you remember we were the only large state that had 5 days a week in person from the beginning of the school year for the whole year. We had about 60% of school districts in Florida had mask requirements. About 40% did not. Most of the charter schools did not have those requirements, and most private schools did not. There's actually the no mask mandate counties had lower per capita cases. So certainly you can't show any type of causal relationship there. And so we did that. I mean, we had the whole school year, and you can look at all these different jurisdictions and see how it was performed. So we believe that the Parents' Bill of Rights was a good bill to sign, and we believe because the legislature passed that, providing parents with this choice flows directly from that. And we think we'll win. We also, though, I think you will see, we obviously have backup plans if there's any type of hiccup along the way. Yes, sir.
Johns Hopkins All Children's Hospital is going to start a vaccine mandate process next month. It'll be fully implemented by December. Are you going to try to stop hospitals from doing vaccine mandates?
For their staff?
Yes.
So it's not something I support. Here's the problem that I think you're going to run into. Hospitals are having a tough time retaining staff. You have people that are going in different, because they have these staffing agencies that come in. You literally could be a nurse at a hospital down the street working for the hospital. Staffing agency will hire you, pay you much more money, and you may end up, they have to contract to bring you right back there at higher prices. So you're seeing that. And look, the first group of people that were offered vaccine in Florida were nursing home residents and then staff of long-term care and doctors and nurses on the front lines. And the uptake on that was, the doctors, I think it was like 80–90% did it. The nurses, it wasn't as much. And so, you know, I'm not supportive of mandates, but I think how that is implemented and how people respond to that, I just think that they're going to be, there will definitely be some reaction to it.
Governor, have you given Alachua County a reprieve from your mask mandate ban for 2 weeks? That's been reported in the Jacksonville market.
I don't know where they're talking about. Parents, it's parents' choice in Florida. And government can't override the parents, and so we believe the parents are the ones that have the choice, and we obviously have an executive order to that effect. And now we're going to have, I think the Department of Education maybe tomorrow is going to meet, the Board of Education is going to meet. I know they've got a couple proposed rules that will outline some of the different things that will happen, but yes, no, it's the parents' choice. Alachua County can't override the parents. I think that's pretty clear from the Parents' Bill of Rights that I signed, and quite frankly, I think that that's the right thing to do anyways. Thanks, everybody. We appreciate it.